Shia, your student physical therapist assistant. How are you?
Good.
I'm good as well. So I see here that you had a total knee replacement about 4 days ago.
Yeah.
Yeah? Okay, so how's that knee feeling?
Swollen,
Okay.
hurts to bend, so
Okay.
it's hurting right now.
If you could rate your pain on a scale of 1 to 10, 1 being the least amount of pain, 10 being the most, what would you rate it?
Right now, it's probably an 8, but I'm sure if I start warming it up, it'll be like a 6.
Okay, so we're definitely gonna get it warmed up so we can do a little bit of exercise with you today.
Okay.
Is that okay?
Yeah.
Okay, so I'm going to start by first taking your vital signs,
Okay.
taking the pulse rate, heart rate, blood pressure. Okay, your vitals look good, so we're gonna go ahead and get you started.
Okay.
So what I'm first gonna do is do a little bit of soft tissue mobilization in your knee to get the blood flowing and release some of that swelling. Okay,
Okay.
is that okay?
Thank you. Yeah.
All right, so I want you to go ahead and lay on your back for me, please.
Okay.
And I'm going to roll your pants up, is that okay?
Yeah, that's fine. Just don't touch the incision.
Okay, I'll be careful. First, I'm going to take the girth measurement. I'm going to find the joint line. I'm going to measure the joint line. So that is about 33.3.
So she did the joint line.
Then I'm going to do 4 inches down from the joint line. And then measure there.
How far do you go down?
4 inches. And that is about 34.5. Then I'm going to go 4 inches above the joint line.
And try to get her knee as straight as you can. Now, this patient lacks a full extension, but try to see if you can measure it when she's as extended as much as she can.
Okay.
Your patients, the other students will be faking, but they just be prepared. You know, we give them kind of coaching before, well, like, you know, to make sure they act it out appropriately. But if they throw a curveball at you, don't freak out. Go with it.
So you're gonna measure extension?
Yeah. So you want to try to get it as straight as you can.
Sorry, just pretend it's my swollen. It's swollen.
Okay. So that is about 45.5.
It's swollen.
Don't worry. Okay, so now I'm gonna do the soft tissue mobilization on you, okay?
Okay.
So for the soft tissue, she's choosing to use the more waxy, not the real glidey. Couple of things she's gonna make sure she does is focus more on the back of the knee. I mean, of course, she'll uncork and all of that, but she's focusing more on a little bit of the swelling, but not getting near the incision. But then explaining to the patient that the back of her knee is very tight. This patient's probably been laying around with a pillow under the knee because it feels better. So she's getting behind the knee. She's really working on those tendons, the top of the gastroc, the hamstrings. She's trying to really break up and loosen those muscles up. So this massage is not really all about edema. It's more about getting in there and working more on the posterior part of the knee to loosen up those tissues. Because she's got contracture here.
Okay, so I'm gonna start by uncorking the hip. Do that for about 30 seconds. And then I'm gonna start by just going like this. Make sure not to go in the incision site.
Good.
And then I'm gonna do a little petrissage at the back of the knee to relieve the tightness. maybe a little friction in the back if I feel something. And then back to effleurage. How's the pressure?
That's good, thank you.
Okay. And then I'm going to take the towel and wipe the stuff off. Okay, I'm going to remove these pillows. And then I'm going to follow up with some stretching of the hamstrings to relieve the tightness.
How long will you hold that for?
30
At least 30 seconds, yeah, good.
Okay. Can we do that about like 3 times? Is that
Yeah, for this, you could do it once or twice.
okay? Okay, how does your leg feel? Do you feel warmed up, ready to
Yeah.
go?
Yeah, I'm ready to go.
Okay, good. We're switching.
Oh, they changed me to.
Okay.
Now I'm the tech PTA patient.
I'm Wendy Goyeneche, and I'm a physical therapist assistant. How are you doing today?
Good.
Great. So I know that you already finished your massage, and how are you doing? How is your knee feeling?
It feels
Are you-
loose. I feel like I'm ready.
Okay. So, well, we're gonna start with some exercises, and then we're gonna practice on how supine to sit, and then sit to stand, and then go to the chair. Okay. You ready?
Yes.
Is that okay with you?
Yes.
Okay, good. So first, we're gonna start with ankle pumps. So you're gonna dorsiflex and plantar flex your feet. That this is gonna be good for the circulation. So you do 3 sets of 10.
Okay.
Good. Great. Good job. So now we're gonna do some quad sets. So, but I know that you can straight Danny very well. So I'm gonna help you. I'm gonna put a towel, small towel under your knee. That it will help you with, give you some support. And then I want you to contract the muscle, the quad, and then you're gonna hold for 3 seconds. Contract, and 1, 2, 3, relax. Contract, 1, 2, 3, relax. Contract, 1, 2, 3, relax. So 3 sets of 10. Good job, you're doing great. How are you feeling?
I feel good.
That's great. So now we're gonna practice well, this is gonna be helpful for you. The quad sets is gonna be helpful for you for the knee because it will help you to strengthen the muscles around the knee. It will help the knee to be able to bend eventually. So now let's practice some glute bridge.
Okay.
So for that, you're gonna bend your knee as tolerated. Of course, you're gonna help you here as tolerated. Is that okay? Feeling good? Feeling okay?
Yeah.
Good. So, and I want you to help yourself. We to lift your pelvis, and then you're gonna hold it.
Okay.
You're gonna up. 1, 2, 3. How many seconds do we need? 3. Okay, so you can hold it for 3 seconds. 1, 2, 3. That's 1. Up again. 1, 2, 3. That's great. How are you feeling? How's that knee feeling?
Good.
That's awesome. You're doing a great job.
Thank you.
So now that we practice some exercises, and then we gonna start the sitting supine to sit.
Okay.
So for that, okay, so see. So I want you to help me. You're gonna help yourself with. You're gonna put your elbows on the bed, and then you're gonna help yourself to sit, and you can bend the
Now, with a knee, does she need to worry about not rolling or anything like that? Not really.
Not really.
Yeah,
So
so,
I'm
Moves
gonna
motions,
help
flexion,
her with
extension.
the operated leg. I'm gonna help support her the operated leg a little, and then she can help herself with the
okay.
strong leg. So this one is your strong leg. So I'm gonna help you support you operated leg, and you can help yourself to sit with using your elbows. You're gonna push up with your arms, and then sure that the bed is wider.
She could also roll onto her side, and you can even have her use her strong leg to help her affected leg off the bed, or you could, the other leg will just kind of naturally come off as well. So she can do it via a side where she kicks her feet off and then just uses her hands to help push herself up.
Right now, I'm gonna help you to sit down. And then you can help yourself with your strong leg. Here. Then you scoot yourself up to the edge of the bed. How you doing? Good. Well, now, chair. So now we're gonna practice sit to stand. With your gate belt. No, that's after. So I start okay with you. I'm gonna.
Which is her affected leg?
The right. So we're gonna practice sit to stand. So you can help yourself with your strong leg, but you can also put some weight on your operated leg, as tolerated. Okay, so you don't have to hurt yourself. So just as tolerated. Okay, and at the count of 3, so you the edge of the bed. Yes, thank you. At the count of 3, we're gonna go to the chair. Okay, so you're gonna stand first. Stand up first. Count of 3, we're gonna go 1, 2, 3. So now we're gonna shoot a strong leg until you feel the chair with your knees, your legs. To the chair. Okay, good. Now we're gonna sit slowly, but how's that feeling? How are you feeling?
It's a little sore, but it feels good.
So now we're gonna go to the bed again. For that, I want you help me. And
Okay, I'm gonna just stop you guys there. Why are you transferring her back to bed? Cause you have, go ahead.
because she's gonna help her to use the walker, but she has.
But let's do that from the chair.
On the chair?
Because if you put her back to bed, then you have to sit her up and somehow be guarding her at the, because remember, you'll be on your own when you actually do this in the final. So you wanna make sure you have your chair kind of on the correct side, ready to go, your gait belt within reach. And also, once you get her into the chair, she's in the chair. Don't worry about putting her back into the bed, because then how are you gonna demo gait? Why don't you demo gait and everything while she's safely sitting in the chair?
Okay.
So we don't have to get her back, just she's in the chair now, let's continue, now that she's in the chair, let's continue on with the treatment.
Now it's Myra. So now Myra's gonna continue with the treatment.
Okay,
And I'm gonna be the patient.
okay.
Hi, Wendy. I see you already warmed up with your glute bridges and your quad sets. So
my
now,
ankle bones.
yeah, and I know that you have steps at your house, and I know that right now you're gonna be using a walker. So I'm gonna be teaching you how to walk in your walker, but before that, we're gonna measure it really quick, make sure it fits you. And then I'm gonna show you how to walk in your walker properly. then we'll hit the stairs, okay?
Okay.
So if you can just put out your left arm, out so I can measure it, okay? All right, great. Good, all right, we're gonna see if it aligns with your size, okay? Make sure you try to use your leg, okay? We wanna bend it as much as we can, okay? But not to hurt yourself, but make sure you bend it, okay?
Okay.
All right, I'm gonna help you up. Make sure you push off the armrest, all right?
What else does she need to do before she gets up?
Scoot forward.
So the little details, I know it sounds like I'm being picky, but we're
Oh,
gonna
yeah.
be looking for those little details. Scoot
Right.
forward, push from the chair. Always remember to tell them, reach back for the chair. Little details like that are gonna be very important.
For
okay?
sure.
Except for Cabot, don't weep that.
All right, ready? 1, 2, 3. All right, yeah, this is definitely really tall, so I'm gonna sit you back
Well,
down.
Let's have her stand up nice and tall.
Okay.
Oh,
Yep,
still
still tall. All right, let's sit down. Reach back on those armrests, okay? Don't hold on to this, okay?
Okay.
So just turn around, find your arm rest, and then lean on those, okay?
Good.
'Cause then this can fall over, okay? All right, sit all the way back. Let me just fix this real quick. 'Cause this is
Good.
No. That's fine. Let's see. This is little. All right, Whitney. Let's do this one more time, okay? Scoot all the way forward.
Sure.
All right, push off those armrests. Ready? 1, 2, 3. Grab onto now your. All right, I think that feels better. How does that feel? Put your arms on here. I mean your
Feels
hands.
great.
Feels great. All right, so I'm gonna sit you back down. So sorry. Just want to make sure it's nice and measured. Okay, find those armrests, and then okay, perfect. So I'm gonna help you. I'm gonna show you how to walk in your walker. Okay. So your affected leg is your right leg. So we're gonna go walker, affected, unaffected, walker, affected, unaffected, okay? I want you to keep straight, don't do this. I want you to keep straight because we want to keep that posture nice and straight. All right? You feel okay on trying that out?
Absolutely.
Perfect. All right, again, push off the armrest, scoot all the way to the front, and then I'm just gonna help you a little bit, okay? But you gotta make the effort, okay? Ready? 1, 2, 3, go.
Ouch.
Uh-oh.
Maida, one thing about how don't put your hand through her arm, because when she tries to
Oh,
stand,
like right
yeah,
here?
go behind
Okay, yeah.
her. Yeah, there you go.
Okay. All right, ready? So we're gonna do walker,
And
affected,
guard her.
okay? Affected, unaffected, walker, affected, unaffected. Perfect. All right, let's get you back onto the chair. You're doing great. Make sure that when you turn make sure you turn on your stronger side, okay? So you keep that knee safe. All right, perfect. Feel that chair in the back of your knees, and then let go of this and find your armrest. All right, perfect. I'm gonna help you. I know you have 2 steps at your house, and I'm pretty sure your husband's gonna help you, but today he's not there to help you. We want to get you up the stairs so you can get into your house with your cat. Yeah, but I'm gonna have you here so you can see me. I don't want your neck. I don't want you to get contractures on your neck. All right, so you got 2 steps, but I'm gonna show you how to go all the way to the top, because then I can't turn around with the walker mid stairs, okay? So what you're gonna do, you're gonna lock your walker. You're gonna place it firmly on the steps, okay? And right here, we're gonna go up with your affected leg, okay? I mean, with the good leg. It's your unaffected. So we're good leg, so that way you can push off and bring your affected leg, okay? And then you bring your walker, place it firmly, then it's good leg, affected leg, then walker, unaffected, affected, okay? Then when you get to the top, you're gonna open up your walker, okay? You place it, make sure it's nice and firm, and then from here, you're gonna go up with your good, okay? Then you're gonna turn around. And when you're going down, because your cat ran away, you're going to do the same thing. You're gonna lock it, place it firmly, and now we're gonna go down with our affected leg, which is our right, okay? And you're gonna go down, then the good, go down with the bad. Make sure it's firmly, okay? This is tricky. So when you have your husband, be best.
Yeah, I would bring it up a little bit so you're not leaning. Yeah, there you
This?
go.
No?
Yep, that's correct.
Yeah? Oh, jeez. Okay. All right. Affected, unaffected.
Yep. Bring it back up. There you go. It's awkward, but just make sure it's just like next to you. You don't have to, just make sure it's next to you. You're not leaning really far forward.
And then once you're getting down to the last step, make sure you bring out your walker, unfold it, and then now you go down with the bad and then down with the good, okay?
So we're not gonna actually have her do that, just
Okay.
for the sake of time,
Yeah.
but where are you gonna guard her when she's going up?
So when she's going up, she's gonna be on this side. So I'll be guarding her right here in the back, on the back. And when she's coming down, I'm gonna be guarding her from the front.
Good. Okay, let's keep going.
Okay, so now that we're done doing all that, you feel comfortable with it? Do you think you need more help with that, or you're good to go home?
She's
Okay, great.
actually at home.
Oh, you're at home.
Remember,
Okay.
she's home, so you can leave her in the chair, actually.
Okay, perfect. But I want you to make sure that you get your home exercise, the quad sets that we had you do, the ankle pumps before you get out of bed. We don't want you to get out of bed and then you feel all dizzy. But that'll help you to warm up, get that knee warmed up, and then once you get out of bed, make sure you practice your sit to stands. So that way you can get that mobility in your knee again, okay? Perfect.
Thank you. Good. Okay. Questions or